Urine is one of the most freely available substances on the planet. Everyone generates some amount of urine over the course of a day, and because of its abundance, plenty of folk remedies have involved urine in one way or another to treat a variety of conditions. Historically, urine has been used as a folk remedy for conditions such as asthma, arthritis, and various types of allergies. Reports actually date back that there was a time when doctors tested for diabetes in urine by taste. But despite what survival movies and some websites suggest, drinking urine might not actually be a curable remedy. Earlier, I sat down with Dr. Abhishek Raut, medical director at Appletree Medical Group, to unpack some of the facts and myths behind urine therapy.
Dr. Raut, thank you so much for the time today.
Thanks so much for having me.
Now, some experts say that drinking urine can actually cure diseases and some ailments. Are there any healing factors in urine?
Well, urine is really primarily composed of water, urea, electrolytes, and other metabolic waste products that your kidneys have filtered out. So essentially, it is serving as a body's way of removing these unwanted substances. Some proponents of urine therapy talk about healing components or compounds, hormones or enzymes that are present. Even if they were, the concentrations of these substances would be so low and generally would represent what the body is trying to get rid of rather than what it's trying to retain or reintroduce. So looking at it from that perspective, from a scientific standpoint, there's really no robust clinical evidence to support that drinking urine can cure disease or provide any significant therapeutic benefit.
Now, in survival movies, it will show people actually drinking their pee to avoid dehydration. Now, as you just mentioned, drinking urine is similar to drinking waste because urine is waste leaving your body. There has to be some negative implications to this.
Right. So yeah, we do often see these in movies as well, where there's a survival situation and someone is drinking their own urine to stay hydrated. But I think we've got to look at those negative implications of this practice as well. So again, urine is primarily composed of water, but it also contains a lot of waste products like the urea, salts, and the metabolic byproducts the kidneys are filtering out. So now, while it may be a source of hydration, consuming that urine can actually put additional stress on your kidneys, and they've got to work harder to bring out those toxins out again. Also, there's that risk of bacterial contamination. Urine is not sterile once it leaves the body. So drinking it can certainly introduce harmful bacteria into the digestive system and lead to a lot of infections as well. And also the concern here is that concentration of salts and urea is going to exacerbate the dehydration rather than alleviate it, especially if it's going to be consumed repeatedly. So overall, no, we don't expect that would be very helpful at all in a survival situation.
Now, you've made it clear that you aren't agreeing with all of what the experts are saying and all the health benefits in urine. But a report in Nigeria says that urine is actually used as a home remedy to treat children with seizures. What do you make of this report?
Well, so if we look at countries like Canada or Nigeria, or in fact any country worldwide, the systematic approach to seizure management really focuses on bringing down the electrical activity of the brain safely and effectively. So regardless of the country, what you are going to find is standardized drugs like carbamazepine, lamotrigine, or Keppra, which have gone through a lot of extensive clinical testing. Now, it's understandable in many countries throughout the world, traditional remedies have emerged out of necessity or cultural belief, especially when we do not have access to modern healthcare. But in the case of childhood seizures, the concern here is risking or delaying effective treatment can be very significant. Those seizures can remain uncontrolled and lead to more neurological complications, developmental delays, or even other serious health issues.
It's also believed that consuming urine can actually whiten your teeth because of the ammonia content in it. Is there any truth behind this?
So that's an interesting question because the ancient Romans did employ urine for dental care and because what they saw was that urea in the urine can decompose into ammonia. And there's in fact Roman poets who have written about urine as well and how it has helped them whiten their teeth. But what we do need to keep in mind is in urine, it's actually a very small amount of ammonia. And those ammonia levels that are found still raise all the issues that we've talked about, hygiene and bacterial contamination. And we do have very safe, modern issues that we can use for dental whitening. Hydrogen peroxide has been validated for both an efficacy and safety perspective in whitening teeth. So in this case, while it was used by the ancient Romans, there are so many better products that we can use for this as well. So my favor would be to really focus on those modern practices.
Some social media influencers are actually claiming that by consuming or putting urine on your skin, it'll help treat acne or skin infections. Are there any benefiting factors to urine being used on your skin?
So that's a very interesting question as well. Now, this claim is all coming from the urea in the urine. Urea, again, is a naturally occurring compound. It does play a role in skin hydration and gentle exfoliation. And in fact, in modern dermatological products, we do use synthetic urea in controlled concentration, somewhere between 5 to 10%, to soften the rough or dry skin as well. So theoretically, there is some truth to this. But again, the urine concentration or the urea concentration in urine is so much lower, less than 2% anyway. So it makes it unlikely that the raw urine itself is going to have much of a therapeutic benefit. Plus, you're taking all of those waste products we discussed before and putting it on your face as well. So there's hygiene concerns with that, and not to mention fluctuating pH levels. So again, there are much better ways. Even if urea is working very well, there is synthetic urea, which we can use, which can certainly improve your skin. And at the same time, you don't risk the other issues that we've spoken about.
Now, you've made it clear that although there are some positives to using urine as medicine, there are lots of negatives. So how important is it to not believe everything that you see on the internet?
I think what we do see is there is a natural pattern of people reading something online or seeing something online. And we do see these trends come back and forth. These trends come back and forth for many reasons. There's probably a slight amount of truth in there, like the urea and the urine, for instance. And secondly, it's very sensational. It's very interesting to look at urine, for instance, and its properties as well. The important thing with all of this is to take all of that and keep that in mind. And then look really at talking to your professionals. Now, whether there's a small grain of truth in that or not, isn't as helpful as the modern products we would have for a lot of these issues. So speaking with your doctor would probably be the best approach when it comes to your health.
Dr. Raut, thank you so much for the time today.
Thanks so much for having me.